All right, picking up where we left off, this is part 2 of chapter 4, covering the birth process. All right, we just concluded talking about birth rates. Now we are talking about alternatives to hospital technology. There are various places where birth can take place. Here in the United States, it's commonly a hospital labor room, or there are birthing centers, or it can be done at home. Home births are a little different. Planned home births are more common in many developed countries, perhaps because they don't have hospitals as available as we do. And almost all babies are born at home in poorer nations. Some research indicates home births entail risks for the baby, and every study finds benefits for the mother. Problems and solutions. There are harmful substances that can make its way into the fetus. These things are called teratogens. They are agents or conditions that can impair prenatal development and result in birth defects or even death. There are behavioral teratogens. These are agents and conditions that can harm the prenatal brain, impairing the future child's intellectual and emotional functioning. About 20% of children have problems that could be traced to behavioral teratogens. There are also prenatal teratogens. This is any agent or condition, including viruses and drugs, that result in birth defects or complications. All right, and risk analysis factors. These discerns which chances are worth taking and how risks are minimized. This involves critical time, dose and or frequency of exposure. This is a threshold effect. Innate vulnerability, and teratology. This is the science of risk analysis. All right, now we're going to zoom in on each of those things I mentioned. This is discuss the critical time. This involves that threshold effect. Certain teratogens are relatively harmless until exposure reaches a certain level. Thresholds are controversial, though. As an example, alcohol consumption. An embryo exposed to heavy drinking can develop fetal alcohol syndrome, or FAS. FAS is more apparent when women are poorly nourished and also are cigarette smokers. Scientists disagree about the strength of the correlation between FAS and drinking alcohol during pregnancy, though. All right, now we'll discuss innate vulnerability. Some zygotes carry genes that make them vulnerable. Male fetuses are more vulnerable to teratogens than female fetuses. A mother's genes affect the prenatal environment she provides. The neural tube defects are more common in certain ethnic groups, for example, Irish, English, and Egyptian. There's also spina bifida, in which the tail of the spine is not enclosed properly. The enclosure normally occurs at about week 7. And there is also anencephaly. This occurs when part of the brain is missing. There is conflicting advice from doctors and scientists. As for the advice from doctors, the problems include provision of potentially dangerous prescriptions for pregnant women and failure to take the time to understand a woman's life patterns. Advice from scientists, the problems are provision of contradictory interpretation of research that led to an opposite message, and internet site usage. Many internet sites provide inadequate or incorrect information about drug safety. What do we know? Prenatal teratogens can cause structural problems during embryonic period and several diseases throughout pregnancy. This can also bring about behavioral problems and reproduction impairment later in life. All right, and prenatal diagnosis. Early prenatal care can protect fetal growth, make birth easier, and render parents better able to cope. Early pregnancy detection provides early recognition of potential problems. It can raise anxiety and present false positives. All right, now we'll discuss low birth weight. It's a problem that can occur. Low birth weight is defined as being less than 5.5 pounds at birth. There's a very low birth weight category. This is for anything under 3 pounds 5 ounces. And extremely low birth weight is anything under 2 pounds 3 ounces at birth. This occurs because sometimes they are born preterm. This is a birth that occurs at 35 or fewer weeks after conception and is usually associated with low birth weight. Another category is referred to as small for gestational age, or SGA. Birth weight is significantly lower than expected given the time since conception. Low birth weight in the mother. Maternal behavior can affect the birth weight in terms of health and illness and maternal drug use before and during pregnancy. Father's behavior can also affect birth weight. Father's attitude can help change things. Is he supportive or not? And the relationship between the mother and father is a factor. Is there stress involved, or is it a good relationship? There's also the immigrant paradox. Many immigrants have difficulty getting education and well-paid jobs. Their socioeconomic status is therefore low, and low SES correlates with low birth weight, especially in the United States. There are consequences that come with low birth weight. There's a high risk to infants and children. They are later to smile, to hold a bottle, to walk, and to communicate. Middle childhood can be difficult for formerly SGA children. They have smaller brain volume. Remember that risk analysis gives odds, not certainties. In comparing nations, there are fewer low birth weight babies than 2 decades ago, less malnutrition, and better mortality statistics. Rising low birth weight in sub-Saharan Africa due to global warming, HIV, food shortage, wars, and other problems. There's overall lower but differential low birth weight in the United States. Complications during birth can have consequences. Rarely has a single cause. There's cerebral palsy, which is a genetic sensitivity. It's a disease marked by difficulties with movement. It is due to genetic sensitivity, teratogens, maternal infection, and birth complications. There's also a condition called anoxia, which is a lack of oxygen during birth. All right, the new family, the newborn. We're going to discuss this scale here, the Brazelton Neonatal Behavioral Assessment Scale, the MBAS. This test is often administered to newborns. It measures responsiveness and records 46 behaviors, including 20 reflexes. Parents who watch their infant perform on the MBAS are amazed at the newborn's responses. This fosters early parent-child connection. So I brought up reflexes. So what is a reflex? It is an unlearned, involuntary action or movement in response to a stimulus. A reflex occurs without conscious thought. Newborns seek to protect themselves with 3 sets of reflexes. The first is maintaining oxygen. This is breathing, hiccuping, and sneezing. The next is maintaining constant body temperature. They do this through crying, shivering, and tucking legs to the body or pushing. Managing feeding. This is the sucking, rooting, and swallowing reflex. All right, there are other reflexes that are not necessarily for survival, but signify the state of brain and body functions. These include the Babinski reflex. This is when a newborn's feet are stroked, the toes fan upward. The next is called the stepping reflex. When newborns are held upright, feet touching a flat surface, they move their legs as if to walk. The swimming reflex. When held horizontally on their stomachs, newborns stretch out their arms and legs. The palmar grasping reflex. This is when something touches a newborn's palms, the newborn grips it tightly. And lastly, the Moro reflex. This is when someone bangs on the table they are lying on. Newborns fling their arms outward and then bring them together to their chests, crying with wide open eyes. All right. For new mothers, about half of all women experience physical problems after giving birth. Sadness and inadequacy are felt by 8 to 15% of new mothers in the days and weeks after giving birth. Symptoms range from baby blues to postpartum psychosis. Depressed mothers find baby care burdensome and may think about mistreating the infant. Paternal involvement can have a beneficial effect, and the causes for postpartum depression vary. Not only fathers, but the entire social network and culture and social network and culture are crucial influences. The father's role is mostly being there, helping the mother to stay healthy, and helping the mother to manage stress, because this affects the fetus, and providing legal acceptance. This word I am not sure how to pronounce, I will guess at kuvade. These are symptoms of pregnancy and birth experienced by fathers and may not allow themselves to be stressed. So that's like a sympathy pregnancy. And the parental alliance. It involves commitment by both parents to cooperate in raising the child and is especially beneficial when the infant is physically vulnerable. We've talked about mothers individually, fathers individually, the aspect of being an alliance. There's also family bonding. There's the parent-infant bond. Bonding involves strong, loving connection that forms as parents hold, examine, and feed the newborn. Something called kangaroo care, in which the newborn lies between the mother's breast, skin to skin, listening to her heartbeat and feeling her body heat. And this early skin-to-skin contact is not essential for human bonding, but helps very much. And that concludes the lecture for Chapter 4.